Hello all, I am Dr. Prashanth Babu, Consultant Pediatrician and Neurologist at Yashoda Hospitals, Malakpet, Hyderabad. So first we will know what is a preterm baby or a preterm premature baby. Preterm baby or a premature baby is a baby who is born less than term. So as all we know, term is up to 37 weeks of gestation age to 40 weeks of gestation. So it is clear that any baby who is born less than 37 weeks is called as premature baby or a preterm baby. So generally it gives an immense pressure in the families and it gives a lot of pressure to the parents as well once a newborn baby has arrived in the families. But sometimes they may arrive too soon or too early, which may show some anxiety in the parents. This is because any term baby or a preterm baby is normally differentiated, or they are a little bit different from the normal babies. So in the aspects of their development, growth and their morbidity and mortality and follow-ups. So normally by looks, a preterm baby differentiates from the term baby with their thin skin and sparse hair, weak cry or a small cry, and decreased muscle tone or decreased movements, and the temperature instability, and their decreased capacity to fight with normal infections as compared to a term baby. So what is the common causes? As we know, what are the common causes for a preterm baby or a preterm birth? Most of the times preterm baby or preterm birth, preterm delivery happens without any reason, just like spontaneously. So we cannot find out any reason in that cases, but sometimes there could be maternal causes, that is any risk factors for the mother. Most commonly infections. Just generally we treat the infections, but still they may induce preterm contractions or preterm labor. Sometimes maternal risk factors like hypertension in pregnancy, or sometimes it becomes uncontrolled, that is called preeclampsia or eclampsia, where we need to induce the pregnancy and cause the delivery. That leads to a preterm delivery. Sometimes gestational diabetes mellitus also can be a cause for a premature birth. And sometimes even twinning or triplets, multiple baby birth also can be a cause for a preterm delivery. Sometimes there can be even causes from the baby side as well. That is, if the baby or a fetus has any developmental anomalies or abnormalities, then that can predispose to, or that may sometimes rarely induce to a preterm delivery as well. So what is the need for a preterm baby to be taken extra care? So most of the times they may not maintain the temperature, as the body organs are not fully developed. They may need more extra care in the NICU. So once the baby is delivered, we will take the baby to NICU, and most of the times they may need help for breathing most of the times, as well as feeding, because their stomach and intestines are not fully developed, and to maintain the temperature as well, because their body fat is less and the development is also very low. And they may need extra care for fighting the infections which are very common in the preterm babies. Based on their weight, gestational age and the prematurity, preterm babies will be in NICU, and they may need care in preterm, in NICU, maybe for sometimes for days, for weeks, and sometimes for months as well, based on their gestational age, in order to catch up and grow for the weight and fight the infections, and they become fully mature and they can lead the life independently without any support.
Like, comment, and subscribe for more health updates.